In this video, I'm going to talk to you about a very controversial word in breast implant surgery. Breast implant illness. A very poorly understood phenomena, very controversial. Many doctors don't believe it exists, many believe it does. Many patients believe breast implants have destroyed their lives, and the largest majority of patients believe that breast implants have totally transformed and made their lives much happier. So let's try to analyze the literature. Let's try to analyze what may be the truth behind breast implant illness. So as I Google in my laptop, I Googled breast implant illness to find out some important aspects related to it. In fact, what is strange is that breast implant illness is not even discussed in plastic surgery conferences. The reason being, one, it is not 100% clear that it is real. Yes, there are some patients who have had problems. You open up Google and make a search of BII and you will come across thousands of stories where patients have suffered from problems perceived to be due to breast implants. Not well understood. Has it been proven that it is due to breast implants? No. Very difficult to prove. There are some suppositions. As I am reading some of the literature here, so there are doctors who claim that there may be an autoimmune phenomena involved in it. That is very difficult to find out before surgery. There not been clear identification of markers which may predispose someone to breast implant illness. It's very difficult to identify. There has not been clear causal relationship, which means that you do breast implant, you will get BII. It's not been proven. Further, breast implants remain the commonest plastic surgery in the world. I don't know, thousands daily get breast implant surgeries, and when you look at the incidence of breast implant illness, I don't believe the data even suggests that even 1% of patients, probably even less than 0.5% of patients actually suffer from breast implant illness. So some of the symptoms which come in BII are headache, conjunctival problems, blurry vision. There's a full chart, in fact. If you look at the charts, it shows off a lot of symptoms like joint pain, sleep disturbances, depression, headache, breathing problems. Very variable. Now, they can occur in otherwise even other people as well. There may be stress at home, there may be stress in life, there may be something which is causing all these things. My personal view is that breast implant illness, if it happens in someone, needs to be recognized, needs to be handled seriously. And if the patient feels that it is because of breast implants, then it is better to take it out rather than to let them be with it. However, it is essential to give a fair trial as well. I've had a patient who 6 weeks after surgery told me that she wants to get rid of it. I said, why? I'm not feeling good, I have pain, I'm depressed, I'm not feeling well. So immediately I started thinking, is it BII? Young girl. And then I said, okay, let's make a deal. Let's wait for 3 months. Settle down with them. If you have a problem, I will take. No question. But just give me 3 months. And 3 months later, when she came for a follow-up, she was the happiest person on earth. She just did not want to even think of removing them, because a new dimension to her life had been totally transformed. So our own personal experience, a lot of doctors in India will say the same thing, that they have not encountered anyone with BII. I think it needs to be taken with a lot of perspective. It needs to be understood that how real it is. Is there a clear scientific basis for it? Probably not. So my suggestion to everyone, if you're considering a breast implant surgery, do not hesitate to do it. Go ahead with it. The incidence of breast implant illness is not clear. The causal relationship is not clear. Whether the treatment of removal makes the problems go away is not clear. Is there a specific cause for this? It's not clear. Has a psychological analysis been done for patients who have undergone, who say they have BII? Not clear. The data doesn't support it. I've been going through a lot of data and it's not been supported. So till then, till we get a clear causal relation, my suggestion, my recommendation is, do not hesitate to do breast implant surgery. Breast implant illness is something which is so rare that it should never form the basis for your decision. If you want to get in touch with us, you can contact my team. My name is Dr. Amit, I'm the director